HealthWorks, providing trusted, culturally appropriate information and resources. We aim to strengthen vaccine confidence and prevent outbreaks of vaccine preventable diseases where we live, worship, work, and play. Increasing access to vaccine and booster shots for diverse, medically underserved populations. Engaging communities, families, and businesses in the fight against COVID-19.
Thank you for joining us. I'm Kermit Payne with One Joshua Group, and we are more than delighted to have our guest today, Dr. James E.K. Hildreth. Dr. Hildreth is President and Chief Executive Officer of the esteemed Meharry Medical College in Nashville, Tennessee. Dr. Hildreth, thank you for joining us.
Thank you, Kermit. I'm pleased to be with you today.
As you're aware, Meharry Medical College, Morehouse School of Medicine, and the Ashland Group were fortunate enough to be funded by HRSA to create a consortium that looked at COVID-19 in the places where it's important. And that is engaging communities to address issues related to COVID through education and vaccination. Dr. Hildreth, why do you think it important that a consortium that includes two of the four HBCU medical schools is significant for this activity and this engagement?
So, Kermit, one of the biggest challenges we had in responding to COVID-19 is the level of mistrust that has been engendered in minority communities over a really long time. I actually tell people I can take you all the way back to 1619 and give you examples of why the minority community should be mistrustful. But as two of the most trusted organizations in minority communities, I think Morehouse and Meharry certainly have earned the respect and trust of our community. So I think it's really important that we've been involved in this process.
Mm-hmm.
And to me, that's why I've been so happy and pleased to see our organizations do what we've done. So I think that to me is why it's so important that we be involved.
So thank you for that, and thank you at Meharry for taking one of the leadership positions as a principal investigator in this. And Dr. Hildreth, part of what this consortium includes are minority businesses and being able to take vaccination and vaccination education into major businesses. We talked about small businesses, but many of the people in our communities work in these warehouse kind of industries and in these jobs.
Right.
If you could speak to businesses about the importance of education and being vaccinated and boosted, what would your message be to the big businesses that employ thousands and thousands of people in our community?
So my message would be that I think they have an obligation to make sure they're protecting the health and welfare of the people who they employ, who some of them actually take care of the rest of us. I mean, they provide services that we all need. So I think it's incumbent upon those large organizations to make sure that those individuals are protected. And sometimes that means they should be the ones making sure that their employees get the information they need to be empowered to protect themselves regarding mitigation of COVID-19. Then also making sure that those individuals they employ can access the things they need to access to protect themselves. For example, as part of President Biden's Health Equity Task Force, we considered how challenging it was for some people employed by big businesses to take time off to go get a vaccine shot or to go get a test because they'd have to do that without getting paid or compensated for it. So I think that the big businesses need to make sure that information is available to their employees, but also make it possible for them to facilitate or take advantage of all those things that are needed to protect themselves. Because oftentimes, people who work in warehouses or meat processing plants or other kinds of settings are least able to advocate for themselves. So it's really important that the organizations that they work for do so on their behalf. So I think it's really important that they do that.
And thank you for your service on President Biden's executive task force on COVID. We talked just a minute ago about some of the larger warehouses, and then to get back looking at workforce and to get back at the program for HealthWorks. HealthWorks has a component around education. And you're using community health workers, training community health workers,
Hmm.
training business ambassadors. Do you
Hmm.
think that this kind of training at the community level has an opportunity to contribute to the complexion of our workforce as it pertains to minorities?
I certainly think so, Kermit. One thing that I'm excited about in terms of the community health workers is that we've known for a long time that messages are meaningless unless the messenger is trusted. So by taking people from communities and training them up as community health workers, we've solved a major problem because we have somebody who's from the community, of the community, conveying those messages. They're going to be much better received and internalized. And if, as often the case, someone from an outside organization does so. So I think that's really important. The other thing is uh, community health workers have the potential for engaging and inspiring others to want to become involved in the healthcare workforce. And we know, as you're probably aware, that when the healthcare provider workforce reflects the people they're taking care of, outcomes are better. So I think on that basis as well, having community health workers from the community is going to be beneficial on lots of levels. And I think is a really exciting part of this program that we're involved in.
Now, we've engaged Meharry Medical College, we've engaged Morehouse School of Medicine and Ashland Management Group. So, Dr. Hildreth, how do we reach out to not just HBCUs, but other academic institutions and use this model to get people vaccinated, to teach people more about COVID and other chronic diseases?
Hmm.
Because as we begin to train um, health care, health um, ambassadors, business ambassadors, and community health workers, it also is going to allow us to reach into our neighborhoods and help train caregivers who
Yes.
long term are going to be responsible for taking care of those people who are most vulnerable, the aged, older,
Right.
people who
Right.
have long term chronic diseases. How do
Hmm.
we engage the other undergraduate academic institutions using this model and other presidents like yourself to be involved with this message, as you mentioned, trustworthiness?
Well, I think one thing that COVID-19 did uh, was to help people understand the powers they can take to protect their own health and the health of their family. So there's a level of awareness of self care, I think, that hasn't existed in our country for a really long time,
Hmm.
all the way down to people in undergraduate level. That's reflected by the fact that we normally get 7,000 applications for 100 seats in our medical school.
Wow.
Just most recently, we got 10,000 applications for those same seats because the level of awareness of healthcare and what can be done as a healthcare provider was elevated to an extent I don't think I've seen before in my professional career. But it also carries over into the families of those individuals that I'm referring to who are applying for medical school or dental school. They've kind of become ambassadors for what is possible. So I think that we need to encourage that. We need to make sure that all the presidents of undergraduate institutions, especially HBCUs, are promoting that kind of spirit among the undergraduates because it's become obvious from all the things that are happening. And I don't want to go into all of these things that sort of bring us all down. I apologize. Do I need to do anything?
You're good. You keep going. This is live.
Okay.
We're good.
Okay. Um,
It's life.
that there's so much happening that might be discouraging to young people who are looking to have a brighter future. That I think is important for them to understand that they can take some control of what's possible for the future and have a huge impact in our communities by getting involved in healthcare, by getting involved in public health, by making sure they're the ones conveying the messages. When I've been asked by large corporations to speak to how they can achieve health equity or contribute to it, I suggest to them that they lead from behind. What does that mean? Identify someone in the community who is an opinion leader or trusted messenger, and you support them in that effort. You should not be the one necessarily going out into the community because you're not going to be well received for a lot of reasons. But if you can identify someone in a community-based organization or someone in the community that is trusted, that you can empower, give the capacity, that would be a really powerful way for you as an organization to have a contribute to achieving health equity. And I just call it leading from behind.
So, Dr. Hildreth, as a scientist, what lessons have we learned from COVID-19?
Um, well, there are lots of lessons, Kermit, and I'm an HIV or infectious disease researcher of long standing, and one of the lessons that I think we learned is that viruses do not discriminate. Um, for example, what I mean by that is the burden of disease for a lot of chronic diseases is disproportionately borne by people of color, by minorities. But as you know, SARS-CoV-2, the virus that causes COVID-19, if it found a human being with the ACE2 protein, which all of us have, and afforded it the opportunity, it was going to infect that person, possibly make them sick. So I think one of the lessons that was learned is that when it comes to a virus, all of us are vulnerable and all of us can have an impact on the people around us. And one of the things it taught us about America, about the United States of America, we're not quite there when it comes to living up to that expression you hear all the time that we value all lives the same. One of the lessons we learned is that sounds all well and good, but if you look at the data in front of us, it clearly is not the case because I said this and I'll say it again. Early on in the pandemic, I made note of the fact that after 100,000 people had died, one would think that'd be enough to galvanize the attention of the country. But I'm still convinced that because most of those people were old, brown, or black, it did not have the same impact if the profile had been different. So one lesson we learned was that we don't quite live up to that mantra we have as a nation that we value our lives the same. We clearly do not. But one of the lessons that was learned that I think that in our communities is powerful, needs to be latched onto and promoted is that all of us have the power to improve our own health, to protect our own health by making the right decisions about the things we eat, the people we interact with, accessing healthcare or not can have an impact. So I think one of the lessons that I think is really powerful that I want us to be focused on is how each of us as individuals and as part of communities can have an impact on the health of the rest of us. And I think that's really important because COVID-19 is not the last health crisis or public health crisis we're going to deal with. So I'm hoping that some of the lessons we learned from COVID-19 will help us get through some of the future challenges we're going to have because they are coming. They are coming. Thankfully, monkeypox is not as contagious or as pathogenic as SARS-CoV-2. But as you can see, it's just another example of one of the public health challenges we're presented with that we have to face together. Because after all, we're the vectors for these viruses, giving them to each other. So we have to depend on each other and protect ourselves. So that's a major lesson, I think.
So, Dr. Hildreth, thank you. We intend to follow the science. We appreciate you sharing that
That's
with
what we
us.
should do.
And thank each
Yes.
of you for joining us with Dr. James E.K. Hildreth, President and Chief Executive Officer for Meharry Medical College. And Dr. Hildreth, thank you so very much for what you do and also what Meharry Medical College does. Until next time, be kind, be compassionate, and be safe. Thank you.
Amen.
We would like to thank our special guests for joining us today. This HealthWorks podcast series is supported by the United States Department of Health and Human Services and the Health Resources and Services Administration. The contents are those of the speakers and do not necessarily represent the official views of, nor an endorsement by, HHS, HRSA, or the U.S. government. Don't forget to subscribe to receive notifications about future episodes, and be sure to share this information with your family, friends, and colleagues. Here's to bringing about a great change and improving health. Until next time, stay safe, be kind, and be compassionate. HealthWorks, providing trusted, culturally appropriate information and resources. We aim to strengthen vaccine confidence and prevent outbreaks of vaccine-preventable diseases where we live, worship, work, and play. Increasing access to vaccine and booster shots for diverse, medically underserved populations. Engaging communities, families, and businesses in the fight against COVID-19.